everybody. Welcome back to Psychedelics Today. This is Joe Moore coming at you from Breckenridge, Colorado. Today on the show, we have a new exciting guest, Matt Ball, a psychiatric nurse practitioner in Australia. And he recently was in our Navigating Psychedelics class, and we had some really interesting conversations. And I really wanted Matt to come on the show. Got to know him over the course of 8 weeks and was very impressed, very interested. And I hope you are too. So this is kind of, in a sense, a continuation of the conversation with Will Hall and Dr. Craig Heacock. And if you haven't heard those episodes, they're worth checking out, but you don't really need to listen to them before this. I just suggest if you like this episode or had issues with this episode, you go listen to those 3 as well. Trigger warning, there is some suicide talk in here. So if that's going to cause you some issues, probably skip to the next episode. And yeah, we do go into some touchy things. We critique the DSM quite extensively. We talk about schizophrenia quite extensively and suicide quite extensively. Yeah. And there's also a quote by Albert Camus in there. I think I called him French. I don't think he's French. I believe he is from Algeria. So sorry if that offended anyone, but no, it says he is French here. And he did win the Nobel Prize for Literature in 1957. So yeah. Okay, so he was born in French Algeria, died in France. There it is. So yeah, I think that's it for now. This is a really fun episode. I really enjoyed recording with Matt. I really want to do more. And I do want to get Matt with some others so we can kind of unpack these ideas and get them a little more exposure. As you know, Kyle and I have kind of a philosophical bent. And as a result of that, there's plenty to criticize out there. So I still think doctors are great. Nobody's going into medicine to hurt people for the most part. And yeah. So this is just a critique. Please take it as such. And let's see if we can be on the same team and do better. Yeah. Anyway, on with Matt Ball. Probably do a few ads here and then on with the interview. We'll see you on the other side. Hello, everybody. Welcome back to Psychedelics Today. Today on the show, we have Matt Ball, psychiatric nurse practitioner in Australia. How are you doing today, Matt?
Yeah. Hi, Joe. I'm good. How are you?
Doing lovely. I'm glad we were able to sync up given our time zone difference. And yeah, just really happy to finally make this happen. It's been, I think, months on the books, maybe.
Yeah, I'm looking forward to it a lot.
Yeah. So we met, you took our Navigating Psychedelics class and you were a really impressive student. You had an amazing lived experience in professional life and a lot to say. So I'm just really, really excited to be able to share your work and experience with folks. So one of the more, well, let's jump into dissociadelic first. So let's talk about your lived experience with schizophrenia first. How do you like to talk about that?
Well, I do like to talk about it, and I think that's probably a good starting point. You know, I think there is something about coming out of the shadows, isn't there? And as a professional, I guess, and having a lived experience, I've been very open. But there's many of my colleagues who are still living in shadows of their life experiences, which are so vital and have brought them to their work or their lives now. So, like I had my first experience of what people might refer to as psychosis in the late 80s when I was 13. I was in a classroom and then a massive entity came through the wall and was going to swallow me up. It was like an omnipotent kind of warped entity. And then people started screaming and then the whole room kind of caught on fire. The people in the room. It was very frightening. And I think to contextualize that, I was not long leaving a church where I'd suffered abuse. And, you know, we can probably get more into this, but that was the first sort of outward expression of the fact that something was not okay in my world and my life. And of course, nothing really happened about that. And years later, I ended up hearing voices and seeing things and believing things and knowing things other people didn't believe and know and see. And that was when I kind of got diagnosed first with depression, psychotic depression, schizophrenia by one psychiatrist, a few other things as happens, and spent about 3 or 4 years in the mental health system where I would say the best thing that happened was I was after after the medication, the ECT and hospital, I ended up in a housing community for 8 of us who were sort of, I suppose, seen to be treatment resistant in that horrible language. And in that place, I found enormous sense of healing and community. So, yeah, I value now in hindsight many of those experiences. And just returning to that 13-year-old experience, it was around that time that I also read Aldous Huxley's Doors of Perception around 12 or 13 and became absolutely fascinated, slightly obsessed with his description of his corduroy when he was on a mescaline trip.
Yeah.
And that, I'm 45 now, and I can remember the room I was sat in when I read that book and the impact it had on me. So that was all around the same time of having an extreme state. I think it was probably just after I had my first experience. But so, yeah, I've had a long journey, and suicide has been part of that story as well. Tried to end my life on a couple of occasions. And, it's such a big story, so I can say more or less. But one of the things I suppose that we'll come onto with dissociadelic, my interest in psychedelics and dissociadelics in suicide is that a lot of the story around suicide is how we have to get rid of people's experience of wanting to or considering ending their own life. And my interest is in about understanding the meaningful human narratives that manifest in the experience of feeling like we need to escape this life. And so that leads into this idea of mind manifesting realities, which of course is so central to psychedelics.
Mm-hmm. So you used the term dissociadelic. Let's what do you mean there? What does that term mean?
Well, so just to say your course, I mean, the Navigating Psychedelics for Therapists and Clinicians was an amazing course, and it did 2 things to me. One, it upskilled me incredibly in terms of knowledge because it was a well put together and structured course. The other thing is it made me not want to prescribe psychedelics as a nurse practitioner prescriber. And where dissociadelic came from then was, though, I was listening to people on the course and thinking about my experiences and the wonderful humans I spend time seeing for psychotherapy. And I was thinking, I've developed this concept of dissociachotic, which is broadly describing how extreme states, altered states arise within human relationship. And so, and how they can therefore evaporate within human relationship. And that seems eminently more useful than psychiatric drugs and just dismissing people's realities, is that we work through the narratives and stories and see if that has a different experience for a person that's equally valuable and useful. And so dissociadelic, when I was doing this course, became a kind of idea. We had to do a task, and I thought, well, why can we talk to people's voices and find meaning out about their voices now because of the Hearing Voices movement, what it's brought to us, Marius Rom and Rufus May and Dirk Korstens and many others. We've learned we can actually talk to the voices people hear now. So we can make meaning out of that journey together. The person can, the 2 of us can. And that's quite similar to what we do with psychedelic drugs, right? In the kind of integration process, we're actually trying to explore how and what happened in the journey of taking a psychedelic substance and seeing where that relates, how it relates to this life, a past life, a spiritual experience, whatever. And in the modern era, we're looking at trauma, of course. And the Hearing Voices movement, would see voices more as a dissociative reality than a psychotic phenomena, and often related to social or emotional conflict. So I thought, if we can do that when people are already hearing voices, can we not induce these states? And it's horrible language, but can we not create these states like we do with medication by human relationship mechanism? And I think other people have done things around this, and I'm sure some of Stan Groff's work sits in this space. But so what happened next was I was working with a young woman who was telling me that I often do body work, find animals in people's bodies when they're in extreme states. And I asked her what suicide felt like in her body, and she was very easily able to describe this thick, sludgy black thing in her chest. And I said to her, what would it be like if that could come out of your body and talk to you like you, because she hears voices. And I said, so we could talk to that like we talk to your voices. And so she said, oh, well, that would be amazing. I don't know how you do it. So I kind of made it up, if you like, but I used the knowledge that I'd got from the course about you can correct me hopefully if I get it drastically wrong. But what I was thinking was when you interrupt the default mode network and the prefrontal cortex as an idea in psychedelics, that's when you create these altered states of perception. And I'm not really into the biology. I think it's about environment, not biology. But I think there's something happens in the brain. And when we were talking about psilocybin, we were saying that binds to the 5-HT receptors and creates this dump of serotonin somewhere, which interrupts the default mode and the cortex, and so distorts perception. And I was thinking, okay, so if you could do that in relationship and then safely come back together and calm things down, you could have a short kind of psychedelic experience, really. So we did some breathing, very, very basic breathing, and we sat down and I invited this. I mean, I went through this with her first, told her what I was going to do, and we invited this black sludge to leave her body. And in this kind of meditative state, and I say meditative, we breathed for about 2 minutes together. Nothing significant, no big stories in the breathing, just putting our feet flat on the ground and observing our breath. And that was the sort of anapana meditation idea of Vipassana. And then I invited this thing to come out of her body, and she described it reaching all the way across the room and going from being a thick sludge to a kind of semi-transparent, sort of wispy experience. And then I was able to talk to it just as we talk with voices. And I talked to it, and it said some of the most incredible things. I said, "Oh, so hello, suicide. It's nice to talk to you." And she just spoke as this entity, as you do with talking with voices. And it said, "Oh, I'm not suicide. I'm the emotion controller." And it went on to say, this woman thinks that I'm suicide, but thinking is she thinks about committing suicide or ending her life because the emotions that I'm holding are so overwhelming. And actually, I'm here to help her. And I bunch together all the traumas in her life so that, because it's overwhelming, too much for her, but that makes her feel like she needs to leave this life. If she wants to, I can allow her to have access to some of these emotions and traumas. So we then negotiated what it felt like in her body. She said it was calm and peaceful in her body. And we negotiated suicide to come back into her body and share the space with the other feelings she had of peacefulness and calm. And since that time, she has been discussing and exploring big events in her life in a really powerful and skillful way that's I would say, given her some emancipation from just being blocked in trauma, if you like, or stuck in trauma. And I suppose what I would say is that we've used some of the ideas of how psychedelics work to create a relational experience that's allowed a similar process to happen. And of course, it was all about the set and the setting. We have a very long-term relationship, which is based in safety and compassion and love. And within that, we then went to suicide, which was like the shocking experience, which perhaps allowed the serotonin to dump into the brain, if you looked at it through that perspective, and distort some of the perceptions. And then we were able to come back into safety and review the experience together. So she left the room very much having kind of a whole experience, not a kind of experience where sometimes I think when you do all these psychedelics, you probably, before you get to see your therapist or to see your friends again, you kind of have a few days where you're pretty spaced out wondering what on earth happened. Well, we tried to encompass that in one session. And then since then, we talk about it every session, of course, because it was an enormous experience. So there's the set and setting, and then there's the integration. So dissociadelic is the process whereby we try to understand what the person's presenting, particularly in suicide, is a manifestation of their experiences of living. So it's like an extreme state. And so dissociate comes from the idea that it's actually a dissociative experience, and delic is the kind of mind manifesting delos component of the psychedelic drug. So we're talking about a mind manifesting dissociation that actually becomes a really meaningful and important experience, much like a lot of people's experience of psychedelic drugs.
When I hear mental health professionals talk about dissociation, it always seems like in such a negative context.
Yeah.
When it's, just a different way of experiencing reality, right? Like it's not inherently bad or good, I don't think. No. It's how it might affect you. And is it what you want, maybe?
Yeah, I think that's a great principle. I mean, if dissociation doesn't affect you in a negative way, if we think of dissociation, I think of dissociation as a change in conscious state, a change of consciousness, nothing more, nothing less. So we all do it. Everybody does it at some time in their life. And we've said that psychiatric disorders are distinct things, for want of a better word. But in reality, for me, I'm not sure why we would say that any state of mind is anything other than dissociative. And I'm not even stuck with the term dissociative. I mean, I think that's what we use in modern language. But of course, dissociation once upon a time meant setting yourself at variance from something else. So, actually, it's a skillful process, a skillful unconscious process to create the environments which allow us to be safely at variance to situations that might not work for us in one way or another. So, you might be at the counter at a supermarket and drop your money. Well, presumably there's a change in conscious state that when you feel anxious and overwhelmed, you fumble in your hand and drop money that you're perfectly able to hold on to normally. So what's happening there? That's not a disorder, is it? That's just a normal human experience. And then you can look at that across the range of life. I think, I don't know how far we can go here, but I think if you think about sexual intimacy, we might do things in sexually intimate moments that we wouldn't do with that same person while standing in the kitchen drinking cups of tea together. So is that not just a change of kind of conscious perceptual experience? We dress it up as a distinct thing. But there's a whole load of chemicals fly off when you get into a sexually intimate process, and then you're willing to do things or able to do things or want to do things that you wouldn't do when you're in a different situation and there's different processes going on in the brain, like making a cup of tea and getting the breakfast ready for your kids in the morning. And I'm just trying to say that these things happen all the time. So why do we make the distinction when we come to mental states, so-called disorders? And I think this is where Will Hall's stuff, when he was on here recently, was so important. And I understand some people would have found it difficult, but this idea that we hang on to truths that perhaps aren't really truths. Mm-hmm. And I know we might get more onto that in a bit, but so that's where dissociadelic is coming from, is this idea that we're just utilizing the wonder of the human mind to have different states of consciousness depending on what's needed in any given moment.
Interesting. If I was more well-read, I could go further there. But let's talk about the spiritual emergence angle. Like this is, as you said, totally fine to talk about in the psychedelic landscape. Well, kind of. I still think a lot of people aren't comfortable talking about it because it's got the S word in it. But it's not okay to talk about in like the schizophrenia world yet, in the same way it is in psychedelia. What were your thoughts there? I think you had some interesting points around that.
Yeah, look, I think on the course particularly, but I hear it more broadly, this idea that we accept when we take psychedelic experience, there seems to be kind of quite a strong pull to want to explore the spiritual, mystical sides of what we experience when we take psychedelic drugs, and that's cool. But in the mental health world, we often see people's spiritual experiences and cultural experiences, to be distinctly related to a disorder in a certain situation or not. And if we take, we live in an amazing country here in Australia, and we pay our respects to the custodians and traditional owners who have nurtured this land for 60,000 years, and yet we see First Nation Indigenous people in Australia having high rates of schizophrenia, higher rates than white people. Now, biologically, that doesn't make sense, and I think I would say that biological notions of schizophrenia are broadly pointless and haven't been proved. But what my point on spirituality is that many culturally distinct and unique experiences and spiritual experiences will get plonked in the territory of schizophrenia if that person is from a different cultural or spiritual group. And so then we shy away from talking about it at all. I'll give you an example. My stepfather, who's a good man, and he's a minister in the Methodist Church, and he had speakings from God to go and be a minister in the church, right? Mm-hmm. Now, no one would suggest that's psychotic or psychedelic. We'd say that's a meaningful spiritual reality, and he left his job and went and trained as a minister. But when I was hearing voices, was to say I was hearing the voice of God talking to me, it's immediately a symptom of a mental illness. And that's just strong words, but it's a ridiculous position to take, that we can say my stepfather and my experience can be categorized in so distinct ways, because I don't believe in God, right? Therefore,
Right.
his reality is inherently a delusional state, if I want to give it a pejorative kind of negative slant. Or I look at it and say, it's a wonderful, beautiful experience he's got. It's just not my experience. So then I move into the psychedelic world, and I think there's this acceptance that people's experience of psychedelica when they're taking drugs and hallucinations and altered states, when someone says, I had this amazing spiritual encounter, we kind of accept that in the underworld of the psychedelic community. But then we say, but don't do these drugs with people that have got schizophrenia. And I'm like, what are you even talking about? And I don't know if it's different cultures in different countries, but my sense on the course was that in America, the litigation position of professionals is that you need to remind yourself to make a caveat to everything you say so that you don't get sued.
A big portion of medicine in the States,
Yeah, so even on the course we were on, right, people were saying, oh, yeah, but such and such, because, that's schizophrenia. And I was
That's why I love that I don't have a license, Matt. Like, I can say all sorts of shit. And, like, being unlicensed, a lot of latitude.
Yeah, and I have a license, right? And I don't want to live in the fear of being sued when, in reality, there is no scientific demonstrated evidence and measurements of what schizophrenia is and isn't. And equally, there is none of that evidence as to what spiritual experience is. So how do we come together as a world, as a community, as a society, and embrace all ideas as meaningful to that person in that moment at that time? And I actually think it's counterproductive if we get stuck in one or other position. So for me, my experience when I was 13 is that, I was probably trying to tell society something. I'd been sexually abused in the church. Someone had threatened to kill me with a gun outside school. My family relationships had broke down. My father had left home. There was a range of difficulties, and I realized people have more or less, and it's not about what it is. But there was a set of events which had left me feeling pretty scared in the world. And I wonder if I was trying to tell people in my community, there is something scary happening here. And can someone help me and save me? And I would go further, Joe, and I would say, maybe I was wanting to talk about that because I actually wanted to save other people from being abused in the church. And here was this, I don't know if you can visualize it, but this very visual representation of an omnipotent thing coming through the walls to kill us all. And then the kind of Old Testament idea of everyone catching on fire and burning in hell. Well, it's not unusual for people who've suffered sexual violence and trauma to feel sinful and shameful and distressed at what they might have taken part in. And I don't believe I had any responsibility, or anyone does, who's been abused, but I think it's often a common experience. So all I'm saying is that was that my first experience of a kind of dissociadelic state, which got labeled as psychotic and then ignored because no one knew what to do. We just need to get rid of it. When actually there was this was a external manifesting, a call out to people that something was not right in our society. And can you please hear me? And if we go to shamanic communities, we might come around a shaman who's having these sort of experiences because he or she's going to give great teaching to our communities. Whereas in the West, for the most part, we still want to move away from people who are having those experiences and try and stop them having them. And that's a real dilemma for me. So when we get dichotomous in the psychedelic space, this person's got schizophrenia, you can't use psychedelics, I don't even know what people are talking about. And I think some of it is coming from old stories of professionals like myself with licenses who kind of need to hold on to safety. And that's legitimate, Joe. But actually what it does is it gets in the way of the other person's journey and us having a relationship.
So I want to do two things. I want to get into this idea that the concept of schizophrenia, like the diagnosis criteria, like does it exist or not? Like, let's get into critiquing that. And then secondly, I want to get into this idea that we can't give psychedelics to people with schizophrenia. Because I've been encountering a ton of people lately who are diagnosed schizophrenic and use psychedelics. I don't know what that is, but it's a really interesting concept. So to start, Matt, let's like you kind of mentioned that there's not really enough maybe consensus, or like, does schizophrenia exist or not? Like, that's, I think, the phrasing you had earlier.
Yeah. Look, I mean, so I know lots of people will have strong views, and I would ask anyone who's not worked in health services who's listening to this to ask yourself first up, where has your knowledge and experience of schizophrenia come from? And it's come from an institutional narrative in pillars built by men in a patriarchal society who've said this is what this is, and not intending to cause harm, probably with very good intention, but someone said it and it's gathered pace. Then so that's the everyday thing. So if you see someone in the street shouting at their voices, broadly speaking, you walk to the other side of the road, because we know, I guess you would have heard as a kid. I certainly heard if you hear voices, then you're mad. If you have hairs on the palms of your hand, you're mad. These kind of strange folklore stories that have gathered into our consciousness. And then we move, for me, into the idea of my professional. I had some extreme states which I no longer have anymore. And they were categorized because they ticked the boxes of the Diagnostic Statistical Manual to say, yes, this is what schizophrenia is. But, I can tell you in the Manual of Disorders, it even has a caveat to say that these disorders can't necessarily be used as a legal process. It's so the caveat is there, and yet we use them as people's defense for insanity in crimes. I'm not suggesting we shouldn't understand people's stories and experiences, but it's one of my biggest confusions is how we say, oh, this person was guilty by means of insanity, when we're using a diagnostic manual that was made up by a bunch of men in a room in the 60s to diagnose people. And we've built on it and changed it. But there is no more science then than there is now. And there's an amazing book by a guy called James Davis. It's called Cracked, Dr. James Davis. And he interviewed the original task force members of the diagnostic manual. And he also interviewed Alan Francis, the editor of the fourth text revised version. And at origin, they say there was no science for what we were doing. It was an opinion-based thing. And then Alan Francis, who edited the fourth edition, said, no, we know there's no good science, but it would have been too big a job to go back and change it. So this isn't, this isn't Matt Ball saying this. This is documented evidence from the mouths of those who've made this stuff up. So this isn't an attack on psychiatry. It's an attack on, it's not even an attack. It's just an acknowledgement that people did their best to try and come up with an idea. And because it's got so much energy and it's such an unwieldy beast, we're just going to keep going along with it.
Fascinating.
So then if you want further reading and evidence, you go to something like the Power Threat Meaning Framework, which came out of the British Psychological Society, and Lucy Johnson and Mary Boyle are the first authors. And this came along because the clinical division of the British Psychological Society said, we can no longer go along with the DSM, the Diagnostic Manual, when the fifth edition came out. We no longer accept that it's got any scientific validity. So they spent 5 years developing this document that said, actually, we can ask the questions, what's happened to you, not what's wrong with you. And this has long been a mantra of the lived experience movement, of course, but it's actually a really important position that they take, which is, how has power operated in your life on all different levels, from ideological to physiological to coercion to legal? How has power operated, and what's the threat you've experienced? What meaning have you made from that, and how have you responded? What's your threat response? And in the threat response, they include things like hearing voices, anger, rage, distress, everything you can ever think of. But it's a much more plausible way of going back to the individual and saying, okay, what's happened to make you need to act like this in the world right now? And what's the story what's your narrative behind that's brought you to this? And how can you have more power in your life so you have more choice about how you respond to the world outside? And this is, another quote, another reference if people are interested. Professor Bernard Gurin writes about decontextualizing mental illness as a construct. And he says, and he said as in his book, what bad things have happened. If you talk to Bernard Gurin, he actually says, what bad shit is happening in your life? Because the bad shit in your life depicts how you can respond. And a quick example, if you're stuck in a room and it's a soundproof room, you'll stop screaming eventually because you'll realize no one can hear you, but you might start digging a tunnel through concrete, because that might be the option you have to try and survive and get out. And then if we go back to schizophrenia, I would say people's states of extremity are a way of trying to exist and live. And this is accentuated and exaggerated in human relationship because the threat primarily in our world now comes from human beings. So we've become these kind of wonderfully nuanced souls that can understand, okay, I'm sitting in a room with a nurse practitioner who might detain me here. I've kind of got to try and say the right thing, but the stress of that and the fear of that might make my voices start saying to me, just get out of the room, Matt, get out of the room. This guy is not safe. And unfortunately, I say, oh, there's a symptom of schizophrenia. But if I take my badge off and I derobe from my responsibilities of using the Mental Health Act, and the person sees that and experiences that, and we sit for long enough, the voices might calm down and go, oh, you know what? This guy doesn't seem like anybody else in your life. He isn't taking you away. He isn't causing you a threat. Well, at that point, we can't say that's a dopaminergic, long-term biological response because it changes moment to moment. And this was my original idea of dissociachotic, which was that these states of alteredness come when a person needs to place between them and someone else something which keeps that person away from me. Does that make sense? So if I start telling you I hear voices, you might stay further away from me. Now, it might not work too well, but if you prove yourself to be safe and enough for me, then my voices might calm down and we come into more deep relationship. So there's the two things. I've kind of gone off as I always do, but there's two things. Is there any evidence for schizophrenia? Well, once we talked about chemical imbalances, and we still, sadly, tragically, on a daily basis, and psychiatry will tell you not, but on a daily basis, people are still told you have a chemical imbalance in your brain and we're going to give you tablets to fix it. And in the words of Alan Francis, the idea that there's evidence to psychiatric diagnosis, that's bullshit. I think it was, he said.
And we're speaking specifically around schizophrenia here. We're not saying like all of the DSM.
No, I'm talking about all of the DSM, Joe. And I know that'll be controversial. So I'm not saying there's not value in some people's lives to understand their experience through a particular framework. But when we say you have a chemical imbalance, which is depression, that's a bit like saying, as I'm talking to you, I have a chemical imbalance because I'm a little bit nervous. I've got a lot of points to make. So the energy in my body has gone up. Well, there's a change in chemicals, right? But I don't need bloody medication for it. I need to be able to be in relationship with you about it. So if we take depression, I mean, Ronald Pies, who was the former head of the American Psychiatric Association and editor of the Psychiatric Times, he said, no, I can't remember the exact quote, but he wrote in 2018, no decent psychiatrist, no reputable psychiatrist has ever used the chemical imbalance theory as a legitimate and like a literal thing. Well, I think you and I both know that's not true. I think lots of medical professionals and nurses and others have said to people, you've got a chemical imbalance, take this tablet and it'll balance out your chemicals. And that's not demonstrated to be a scientifically accurate thing.
Okay. Yeah. Like that particular topic for sure. Like I've heard that so many times. It's kind of nauseating.
But you've heard, and that interests me, Joe, that we hear it over and over, and yet that's what I'm talking about, the kind of folklore and mythology, that it's ingrained in, particularly Western culture, it's ingrained in our narrative that there must be something wrong in the person for a person to be presenting like this. And I think what the modern movement's saying is, yes, there will be changes in all of us about everything we do, but what's happened to make you need to live in the world in this way? And that's not a chemical imbalance. And there's no science to support the chemical imbalance theories, in my view. And I'm not the most well-read person in the world, but in my final nurse practitioner paper for my master's to get signed off, I argued that it was unethical for nurse practitioners to use schizophrenia as a diagnosis because we had to work in evidence-based models. And being that there is no evidence to define what schizophrenia is, I don't believe it's ethical under our code of conduct for nurse practitioners to use the diagnostic term. But of course, that's
fascinating.
Pretty controversial, I guess. But I should just caveat. I'm not saying that you just leave people in distress. I'm saying what else? What else can we do to be in human connection that might be of value in this person's journey of being? And this is very, a lot of my influences are from Lang, and Lang through various means. But Lang's work explains a lot of this, and I know he did radical things, and of course he used psychedelics, so he crossed both worlds. But for me, a lot of what Lang was saying, I think one of my two quotes from Lang, one is, the treatment is how we treat each other, both the therapist and the client. So he's saying how we treat each other, that will be the therapy. Don't worry about all the other things. And I've forgotten the other quote I was going to give you. So.
Oh, no worries. Artie Lang, very interesting character and under-discussed.
Yeah.
Like the way you're discussing this makes me think like, perhaps Freud isn't the right person here, but like imagine a Carl Jung working with somebody and making real progress, like doing active imagination, sand play, etc., having a relationship, exploring it, I think his model's a little weird, but I still think it's helpful at times.
Yeah. Well, and I really like that. I think his model's a bit weird, and it becomes very fashionable, doesn't it? It becomes a kind of subcultural, accessible idea that we can go into psychedelic fantasy and stuff. And I don't mean fantasy in a pejorative, I mean it in a positive way. I think we need that as humans. But I can tell you, my clinic room's here, and there's 3 full-time therapists here working with people with, in inverted commas, schizophrenia in non-medical ways that is about human relationship, and there's not a lot of wacky things going on here. There is people being in deep relationship, and most importantly, I would say, the therapist trying their hardest to resist the inherent power imbalance that happens in a clinical space. So how do we try to not invade and change that person's life? How do we try and come into contact with whatever that person has available to them in this world at this moment? Because what we actually see here is what in my upcoming paper refers to as evaporation of psychosis. So we see that need for extreme states to appear evaporate when there's enough safety in environments. And that's not brilliant therapy, that's human relationships, in my view. And, I think one of the things we're doing here, which is going to extend this, and it's not just about psychosis or extreme states, but it's about all human distresses. We're going to open up a thing called Just Listening Community soon in our area. Someone's donated us a building, and we're going to open up an emergency department or an ER alternative for people in social isolation and human distress. And we're training 50 volunteers at the moment to deliver this approach. So there'll be no medical oversight, no clinical risk assessments, just a space for people to come and have human connection. And that's
brilliant.
So we're really going to try this out and see how far we can take this idea of, how do you facilitate environments where a person doesn't need to be in the extreme state? And if you see this happen, you realize that this idea of a biological disease that has this long-term form that's stuck and stable as madness, it doesn't make any sense. It doesn't make sense.
So we've got a really interesting thing on our hands as psychedelics become more prevalent, commercially available, etc. We regularly discuss this idea of spiritual emergence. And as things scale up, are we going to see a huge increase in spiritual emergence in the psychedelic world? And I think the answer is yes. I don't know how we're going to handle that. Like, I don't necessarily see, for-profit entities trying to sort that out appropriately. But maybe they will. Yeah. And it seems like your model there would be helpful for this kind of thing.
Yeah, I hope so, because it would embrace the idea that if somebody experiences the world through a spiritual lens, it matters not to me as a therapist. It's a word we don't use enough in the health sector and in therapy is, I am in love with human beings. I am a human being, therefore I want to feel connection with other human beings, which might be love as a broad sense. And so, my hope for myself, as is my hope for others, is that we can live all that we are. We can be all that we are. And so if someone comes into the room seeing and understanding their journey through a spiritual emergence lens, well, why? I might ask myself the question, why would I not want to embrace that? And I know some of the things that happen is we think, well, if someone gets delusional and thinks like, well, but that's the old language. So my job is to stay with my sense of wanting to find human-to-human interconnectedness and relationship, so that I can have the courage to not try and stop someone being all that they are. And Lang said, how does the therapist embrace the often weird world of the other without fearing that they're foregoing their own sanity? And I think that's a great point. Is how much of this stuff that we try and shut down is because it challenges our own experience of being.
Right. This is that idea of politics of experience.
Yeah, that's right. And if you think about the NGOs embracing spiritual stuff, I think there are some, but the Spiritual Emergence Network, I think comes out of the UK for the most part. Katie Mottram, maybe. They are doing some beautiful work around extreme states, psychosis, schizophrenia, and spiritual emergence. They have conferences on it, and they are aligning themselves, in my view, with the main sort of lived experience desire for change. But it's mainstream. It's not something that sits on the edges for me at the moment. It's rather wonderful to see this coming into the bigger story that we're all sharing. So I think it's possible. I guess my dilemma with psychedelics is how we dichotomize between it's okay to say I've had a spiritual experience over here on acid, but the schizophrenic who's got a spiritual experience, well, we probably shouldn't give him acid. I don't even know what people are talking about when they say that, other than some misplaced mythology. And I'm not saying give everyone acid. I don't want to take acid, it's not my thing. But I do want to allow us to get ourselves out the way a little bit so that we can allow people to find their own stories of meaning and environments that work for them. Yeah.
So Spiritual Emergence Network was founded by Stan and Christina Groff years ago, and it became a worldwide phenomenon. I think they had entities in a lot of Western countries, and really interesting. It kind of fell apart in a lot of ways. There's kind of just a referral network of sorts.
Yeah.
Not really the same kind of the hope that there was going to be a facility that, people could just hang out at for a month or two to kind of unwind and be in a good relationship with people. Yeah. Anyway, we could go down that rabbit hole for hours, but I wanted to get back on track here. So we did the schizophrenia thing, like a lack of evidence there. And as far as I can tell, there's very little evidence about why people diagnosed with schizophrenia should not have psychedelics. Have you looked into this? Have you done some literature review or anything there?
No, I haven't. And I think that's probably a really important piece of research. But the flaw in it, of course, is that we're researching something that probably doesn't really exist. So it's
right. If the diagnostic category is broken, then
what are we
data
researching?
Pointing at it. Exactly. Right. So we need a refined diagnostic category of some kind, even if that's what we do.
Yeah. And I think that, we can, I'm not just trying to be nice, but if we refer to your course, we talked a lot about assessment of people before they use drugs, if you're going to do psychedelic prescribing. Now, I don't really like the language of assessment, but I think it's just pretty decent human behavior to really spend time with someone, to know them and them to know you before you introduce a drug or before you support them to take a drug. I think that's just good human behavior, right? Like so we could move away from this idea of assessing whether you've had psychotic experiences or not as a disorder. And we could say, you've had voices for 10 years. So it would seem that, your wonderful mind has a mechanism by which it experiences the world already. I wonder what sticking some hallucinogens in is going to do to that. Because you might actually be getting on pretty well with your voices. You might be living well with voices and valuing their story. I value my story of extreme states. I used to hear this guy talking to me as a voice, and he had a big oversized ginger head. I don't know if you can imagine this, but like a kind of cartoon head, and he was down to the right-hand side of me. And as I'm telling you this, I'm sitting in my office pointing down to where he was. And this is 20 years later. I don't hear that voice, but I can't, I couldn't honestly tell you that guy isn't still there. So It doesn't bother me. I don't think about it. I only ever think about it now when I talk about it. So, so I'm not living well in distress with hallucinations and psychedelic experience. I'm living a good life. I happen to sometimes still just have this kind of nagging sense that there might be a guy who tried to kill me once hanging around just behind me. Last year I was hearing voices, for example, and that wasn't ultimately distressing. It was a pretty beautiful journey. It was a friend of mine who passed away, and I was hearing his voice, and it was deeply meaningful and had deep messages in it. But you might want to say to me while I'm hearing his voice day in, day out, I wonder what it would be like to introduce a drug into your system which is going to change that. And potentially you're not going to be as able to be in relationship with it in the immediate term as you were as you are with your voices. Does that make sense?
So we're dealing with a couple things, right? So we're talking like quote unquote treating schizophrenia with psychedelics, or say the person that had this diagnosis had some other situation going on and wanted some sort of psychedelic treatment or wanted to recreationalize or whatever.
Yeah.
Like then there's, that it becomes a few different things.
Yes.
Is what I'm seeing.
Yes. And I think then there becomes an ethical question. I don't know the answer. Is if I'm working with someone who's hears voices, sees visions, got a label of schizophrenia, how far is it ethical for me to go to discourage them from doing that when they might be living in great distress and personal vulnerability or something? And I'm going to say to them, you really shouldn't do this. But the next person that walks into my room who, has a different life, has some difficulties in life, but doesn't feel as overwhelmed, and say, oh yeah, you're all right to do some psychedelics. And I'm not suggesting either way. I'm just asking the question as a kind of hypothetical. Like, what are we denying that person who has extreme states to be free of some of their distress? Because isn't that a lot about what psychedelics is about? Is about us having new experience to expand our states of conscious and understand the manifesting that is there. So it's not just about the harm we might cause, but it's also about denying people. And we're very powerful when we're supporting. When someone comes to us to ask about psychedelics, whether they're doing it with us, whether we're doing integration with them, whether we're supporting them with preparation, in whatever component we're having, we have an enormous power. And I think we have to work very hard to think about what we might be supporting someone to value, but also what we might be taking away from them if we give a biased opinion. And that's where I think some big research in this area would be, what would we find of people who have extreme states, often called schizophrenia, who take hallucinogens, who take psychedelics? What would be the narrative that we hear from those people? And I can tell
largely that they're helpful is what I've been hearing.
Right. So what is this story? What is this story that we shouldn't take LSD, but don't if you've got schizophrenia, this slightly mythological construct that has some value to some people, but broadly not speaking, more value to professionals than to the individuals. But so if you've got that, don't take it. And I don't really know why we'd go there. Yeah. But I think it also is asking the supporter, professional, whatever role you're in, to be pretty courageous and to believe. So that's where I talk about the kind of, in quote, assessments idea, is the assessment is a long journey. It's not a 15-minute fill in a form. Have you ever been diagnosed with this? Well, what does that even mean? Has someone given their opinion that you've got a disorder that we can't evidence? Well, yes, that's happened to most of us. Oh, well, you're off the list then. Whereas we might. I'll tell you about a guy. A guy came to see me recently, and he's been put on Ritalin recently and some other drugs. And then he said one of the most insightful things to me, and this personifies the other side of this discussion. He said to me, "But I've been smoking weed at the same rate. So how do we know which drug's working?" And I just thought, yeah, that's a really we're talking about induced states by drugs. But if someone's already having a psychotic or extreme state, how do we know what's doing what? Really, how do we know? And I think we need to be brave enough to ask those questions and listen to the people in front of us. Because this guy in front of me who said this, he was making a lot of sense. And the psychiatrist and me are going along with this bizarre prescribing regime. I mean, he's a young person and we're essentially giving him amphetamine. What on earth are we thinking of? And there he is smoking weed, and we're not factoring that into how that interacts with dexamphetamine.
Right.
It's so complex, isn't it? It's so complex.
It's so complex. And like our relationship to drugs is so complex that it's hard to even have a conversation, right? Like I know stand-up comedians who do their best writing mixing edibles, cannabis edibles, and eating Adderall. And like that doctor hears that, they're going to be very uncomfortable for the most part.
Yeah.
I actually really appreciate that combination. It's pretty fun, for me as a pretty healthy person. Psychedelic community is going to frown on me for touching amphetamine. So sorry, everybody, for disappointing you. But, once in a while I'll touch them and I find them quite helpful or enjoyable. And, so and you throw a quote unquote disorder in there and it's a little problematic. So here's an interesting story. Our Kyle and I have a breathwork teacher, kind of philosophy teacher, mentor, Lenny Gibson, and he has a really interesting kind of story, like to tell about integration. And he's saying that psychedelic integration is only a thing we need to do because of our worldview at this point. In the ancient world, the world was quite alive.
Yeah.
And you could talk to things and things were more magical. And that's a little spooky for, most Westerners to hear. Right. So,
well, Joe, can I ask then, what strikes me when you say that is psychedelic integration is not necessarily required, right? It's only in the sort of modern world. So when someone's got a so-called, and I'm doing air quotes, mental disorder, as I've discussed, doesn't really have any real validity other than an opinion, we need to, and we could use the language of integrate that to stop that happening, being expressed, right? So I wonder if what Lenny's saying is in times gone by, we allowed these things to be present and we moved as a society, as a community, with different people's realities. One of the things the psychiatric discipline, of which I'm part, as a professional, has done is we've said, this isn't an acceptable experience, this isn't an acceptable experience, this isn't an acceptable. So that in a way, we're kind of trying to, in inverted commas, integrate that to make people normal again. And I use that language horribly and intentionally because in mental health circles and drug and addiction circles, we say people have to be rehabilitated, right? And you know what?
It's really interesting, Matt. It's like, are we just perpetuating the Prussian education model to produce factory workers into healthcare?
Well, I think so because, and this is great that you've said that because rehabilitation comes originally from the idea of returning people to societal's norms. That's the origin of that word. I mean, just get your head around that. You're in distress and we'd like you to return to the societal norm. And what I'm saying is perhaps we need to deeply hear people's stories in all of their colourfulness because that might actually be a gift to our society. So my big vision in my work is that one day we will look at people in extreme states and say, you are our guides. And I know this happens in some communities, in some sort of shamanic communities and indigenous communities, but in the Western world, we might actually say, behind your distress is a societal issue that could provide healing for our whole society. So rather than try and get rid of your extreme state, I'm going to just sit in awe of you that I have this opportunity to hear you. And when I've heard you, presumably you won't need to express it anymore because the healing can begin. And in our suicide narratives approach, which is where dissociadelic fits from earlier, we've basically said in suicide, it's healing through knowing, and the suicidal person is the wise person that holds the secrets and stories of our society. It's the supporter, me, that has to have to match the courage of the suicidal person who's trying to tell us all a story for our mutual healing. And I wonder if that's
Mm-hmm.
a little bit fits with what Lenny's saying. It was allowed to play out, and that's how we learned and evolved as a species and as a society. But in mental health circles, and even I think in psychedelic worlds, we need to kind of define it to the minutiae to know exactly what's going on. Well, maybe the story isn't making sense of this specific thing. The story is the story behind it, the narrative behind it. And that's, it's tempting to avoid that because that might be quite challenging.
French existentialist Albert Camus, I think, said the only important philosophical question is, should I kill myself or not? And the fact that we shy away from the topic of suicide so much is really troubling. Yeah. And I think even Tim Ferriss is talking about it a lot. Yeah. Or at least has in the past. It's like, I think David Hume, the English philosopher, wrote about it quite a bit. And, the fact that we kind of shut it up is troubling. And, there's some serious authenticity there. Like, I don't know that I've admitted this in public before, but I think most people have thought about it a little bit, at the least a little bit. And I certainly have. Well, Joe, given the state of the planet and everything, and prospects for the future, of course, that's a thing we have to think about.
And I want to say to you, Joe, I feel instantly closer to you by you saying that. So we don't need to go into some big story if you don't want it, but what I'm saying is that if we can have the courage, so what am I supposed to do as the guest on your podcast? Am I supposed to kind of sit awkwardly because you've just disclosed that, or am I supposed to say, oh God, that gives me a real kind of sense of relief inside because as well as trying to end my life twice, I've thought about it on and off for 25, 35 years. And I've got 3 children. Am I allowed to tell you that since my children have been born, I've thought about ending my life? Because that's a politically uncomfortably incorrect thing to say, right? And yet most of us have. This model of suicide narratives we've written, we held a workshop, and at the start about 6 or 7 people of the 20 identified that they'd experienced suicidal experiences of thoughts or taking action or wanting to leave this life. By the end, 19 out of 20 talked about it. And you think, okay, right, that's just a random group of people. So let's stop this mythology that it happens to somebody else. It happens to all of us, or to most of us. And again, I come back to that idea. It's the courage of the supporter. And one of the things I think that happens in mental health, and we're at risk of it in psychedelics, is what's the most sanitary way we can kind of do this, rather than letting some of the stuff hang out the edges. And in the suicide world, the big stories that are grabbed by politics and governments and NGOs is the person who tried to end their life, and as they took action, they realized they didn't want to. I get why that's a really positive and beautiful story. And, you might forgive me if this is difficult for listeners, but I tried to end my life and ended up in ICU and was very sick. And at that time, I still feel like that was a legitimate decision I made to try and end my life. And I don't look back at it and say, oh, the moment I took an overdose, I realized I'd made a mistake. I didn't feel like that. And that's really hard for us to hear because it sounds like it's not making it soft and comfortable for everyone. It's a harsh reality. Now, of course,
life is not soft and comfortable.
No, and of course I'm glad I'm alive now. I have an amazing life.
Same
I have
here.
a wife and 3 kids, and goodness me, I couldn't feel more fortunate in my life. But the reality is that was where my life was at, and I don't need to sugarcoat it. So I think it's just one example of many that we can talk about these things. And I know when I get off this call, I'm going to feel more like staying in touch with you now that we've had these open conversations than I did before. And isn't that the goal of what we're trying to do? We're trying to create a space where people feel they're more full in their sense of living in this world, whether that's through psychedelics or mental health work or psychotherapy or whatever. How can we have a good life within the life that we have? And that takes a lot of courage.
All right. A big portion of this whole thing is quite philosophical.
Yes.
Like we've inherited a lot from history, but we shouldn't necessarily feel enslaved by history. And there's a lot of really amazing ground we can cover if we can kind of shake the shackles a little bit I think that's why I love philosophy so much. Like Friedrich Nietzsche, for whatever reason, quite difficult to talk about, but Freud credited him as being the first depth psychologist. And I think there's some value to that kind of statement.
Yeah. Yeah. And I suppose for me, Joe, when I've just finished doing an online existential philosophy psychotherapy course, and just as an interesting, but the thing in my work that I find most useful to hold on to from a kind of existential philosophical position is phenomenology. So how do we stay with the phenomenology of the person rather than needing our phenomenology to change or impact upon the other? And that is a very philosophical position, but it was what Lang was talking about, and what some of the great thinkers have talked about is, how do I avoid trying to make you think like me, but allow myself to be okay with me? And I would argue, Lang said in Divided Self that it was when people fear nihilism, so not existing in the state of ontological insecurity, so they feel insecure about being, and in that state they go mad. So if we can be together, even in those states of madness, we don't have to be alone, annihilated. But it takes so much courage from both people.
Right.
And I suppose I think in the psychedelics world, what I see is, as we move towards getting licenses for prescribing, is I really fear that we're going to move away from that richness of phenomenology, of deeply listening to one another.
Right. Here's an example, Matt. Like one of my friends was unpacking a psychedelic experience. She had a mystical experience in the session, and the importance of it to my friend was like pretty high. And this therapist, coming from a pretty straight up kind of behaviorist worldview, minimal, well, maybe not behaviorist, but like typical scientific worldview. They really tried to minimize the experience and say it was kind of a biological thing. And that totally deflated my friend. And my friend wanted nothing to do with that person anymore.
Yeah.
So it's, she just wanted someone to sit there and listen and kind of like explore it and poke it around, unpack it, etc.
Yeah.
As opposed to say, what did this have to do with your, childhood?
Yeah. Or what does this have to do with our situation right now? That might also relate to childhood, or it might relate to something else. But and potentially she gets a secondary symptomology of being non-engaging, or having poor attachment styles, or because she couldn't cope with the wisdom of the psychologist. And you think, oh no, she's making a really important phenomenological statement there. This space is not okay for me right now. And that another example of this is you may have heard. Have you heard of targeted individuals?
No, what's that?
Okay, so there is a group of people around the world who are targeted individuals. It's related
talking
to
MK Ultra and aliens.
Yeah, related to that.
Hell
so
yeah,
it'll
Let's
have
do it.
Lots of different names. V2K, voice to skull technology. Getting a diagnosis of schizophrenia when you are a targeted individual is very, very easy, because here's the thing: you're in a double bind from day one. You have a knowing in your living experience of being that people are targeting you. The moment you come into contact with mental health services, you need to be honest and open, because the deceit of the targeters is what causes you ultimately distress. But if you're open and honest in any way about being a targeted individual, you have a delusional disorder, right? And the further you challenge it, the more likely you are to get detained or shackled or medicated, which of course is the double bind of the targeted individual, because often it's about programming, often it's about great groups of people or companies programming us all. So people live in this space of targeted individuals actually wanting connection and seeking connection, but every time they go for connection, people act in a way that demonstrates they're a perpetrator, right, of this targeted individual. What we've been looking at here in our work is how can you support a targeted individual without trying to change their reality? And where we've got to is that it is actually okay for a targeted individual to live well in society as a targeted individual. So my role is to get into accordance with their legitimate reality, as Freud said, but not feel threatened. So I work with a couple of TIs at the moment who initially they would really needed to tell me about all the terrible things that were happening, and they were expecting me to rebut them, and then I become a perpetrator. But actually, I don't doubt that that's their reality of living. And I'm not trying to patronize them. I'm just saying I don't experience what they experience, but they don't experience what I experience. So the work literally becomes about trying to have what I call a coexisting same experience, where we can become more fully into having different experiences of the same reality. And in that space, it seems to create a sense of safety and peace for the targeted individual. But it's, as a therapist, it's hard work because I'm relentlessly taught that this person is having a delusional, bizarre reality. But if I listen to their phenomenology and I get into a call to them, they're not having that's their reality. It's not a delusion. It's a delusion in psychiatry terms, but that's what we've decided a delusion is in psychiatry terms. It's a reality. And this is
a real experience that the person had, no doubt, right?
Yes.
Like this is John Mack, the Harvard psychiatrist that did a lot of UFO work. We published on him recently. And yeah, man, there's some really interesting stuff there. Like, let's treat these people as though it's real and they might get some help.
Well, I would go further, Joe, and say, treat them that it is real. And this is the hard bit for me is if we're gonna accept someone has a psychedelic spiritual emergence, why on earth are we, and we accept that there's a legitimacy to that, and we don't keep questioning it and saying, well, we know that's your reality, but it's not, we kind of know it's not true, but we'll accept it's your reality. People won't be satisfied with that in the psychedelic experience. And so why do we say it's different with targeted individuals? Why would we not say, I'm just going to accept that's one version of the reality of existence?
You know what's amazing? This is actually bleeding right into the Alfred North Whitehead kind of like framework of like all experience has reality, and like there isn't a real reality or fake reality. It's like all human experience has reality, and you're speaking a language that I've been trying to speak for a while. Yeah. And it's like, what is the real world? These are now philosophical questions we have to ask. We thought we had something for real, but it's like now it's really hard to define that and hold on to it for a lot of us. And that is psychedelic.
Yeah, that's right. And I think that that's what I'm talking about, Joe. I'm really enjoying this because that's what I'm talking about the courage to allow the other person to have another reality to mine and not at some point undermine it by saying we're accepting their reality. Well, you're not accepting their reality. Their reality is their reality. I'm accepting my reality and they're accepting theirs. I don't need to accept somebody else's reality. I need to stop trying to impress my reality onto somebody else. Now, I'm not suggesting that I want to leave targeted individuals suffering in great distress. That's not at all. I don't want any misconception by anyone. What I'm saying is I don't need to give that person permission to believe their reality because they already have it. It's their phenomenological experience. And this is what Lang said. I think this is what Lang was talking about when he said, I can't have an experience of your experience of you. I can only have an experience of my experience of you describing your experience. Does that make sense? And so I'm not trying to have your experience. I'm having my experience of you telling me yours. And that's in TI language, but also in psychedelic work. That's got to be so important.
Exactly. Yeah. There's limits to language. There's limits to communication. So yeah, like these are things we're going to have to handle and discuss.
Yeah.
This is really cool. And the interesting thing about John Mack beyond this is that after a period of time, I think he started to become quite suspicious that he was going to be able to have these experiences and verify it from his own, so really well grounded. I think he won a Pulitzer Prize for literature. I think he did a biography on D.H. Lawrence. So he's like one of these kind of, geniuses that was well recognized. And all of a sudden he started to veer into this creepy territory and I think had a lot of really interesting wins as a result of that. Is that the right way to put that? I don't know.
Well, I think
so there's one. Go ahead.
Yeah, I mean, I think it is if I go back to the power threat meaning framework, I think it's he's using power positively at that point, isn't he? He's got the power of being a well-recognized academic institution, and so then he can talk about these things with more authoritative power. And we do need those people. I mean, you can look at the likes of Elon Musk or Bill Gates, and you can have your views on them. But once in a while, people who have this extraordinary power say something that resonates and is deeply meaningful, just as a human. And we need, for right or wrong, we kind of need to use those moments to move forward, I think, because they're recognized as extremely successful people. Now, I'm not suggesting it's a good model, but that seems to be a model that works in Western culture. Certainly, I mean, the opposite to that, which I think we could have, but we seem to have lost, and perhaps I'm advocating, is in Aboriginal community that I've spent time with in Australia, and it's very limited. But what I've seen is you have elders who speak for community, but I've really witnessed deep listening to one another in Aboriginal communities. So they're not saying, oh, which rank are you in our community? They're saying, if you're telling me the ancestors are speaking with you, then we're going to listen. And that's quite different to the idea of someone with prowess speaking and we all listen, because we're saying the wisdom is available to all and beyond all of us. So it kind of levels out the community a bit more. And that's what I'm saying with them when we go back to target individuals and we say, okay, that's their reality, this is my reality. The power in this is that we sit next to one another, acknowledging deeply the differences, but not being frightened and fearful and needing to pull rank over one another.
And I want to do a little bit of clarification on what you just said. So, say I'm at a music festival and somebody's, doing something that looks a little off to me, and then they come up and start like channeling my pet that I lost or something. Like, that's very different from this Aboriginal scenario where these people are already in connection, and they're having, like they have a deep community, a deep lineage, and that's a very different cultural scenario.
Oh, absolutely. I'm glad you clarified that. And I was just using it as an example that this already exists, this opportunity.
Absolutely.
We don't need to recreate it. And if you look at, I would say, all of my work and all of the new things that I've been doing, then I'm not the first person by a long, long way to say these things. And I'm not even the first generation or the first culture. It's happened before. And so that depth of culture in certainly in Australian First Nation peoples is, it's 60,000 years old. So what can we learn from those spaces, but not try and steal, not try and misappropriate, but what can we learn that might be useful to us is a big challenge, I think, in the psychedelic and mental health space.
So last thing I want to get into here, and we talked about this at the beginning, is this idea of microdoses and like prescribing microdoses and like you have a couple concerns around that. Could you maybe expand on that for us?
Yeah, look, and anyone that knows me will have heard me rant on about these things. But my concerns is that by the time we have pharmaceutical grade psychedelics on the market, they won't be referred to as psychedelics in the mainstream. And I think that potentially if you go to your doctor and say, I've lived with difficulties in my life, can I try some psychedelics? That might even become an unwritten reason not for medicos not to prescribe it. People will be seen as drug seekers or whatever. So that's one thing. But I fear that we will have a little white pill in a little silver packet, which is given to you for a particular disorder. And then you're kind of forced in some way or coerced to have psychotherapy. And it'll look a lot like new antipsychotics, if I'm crude. And it's become a kind of holy grail for me in some respects. And that was the motivation behind dissociadelic, was what are the alternatives. So I do fear that when you've got hedge funds investing in, and you've done a wonderful Fridays catch-up podcast that talked about this, if we have hedge funds investing in psychedelic drugs for the market, we know where this is going. And so who wants to take a little white pill that's got a nanobite of a psychedelic in it when actually what you want is some psychedelics with your friends to work through difficult community journeys? And
I'm going to have some ethical issues as a prescriber and a therapist to think about how much I'm going to join in with that story. And it'll all, of course, be tied to the Diagnostic Statistical Manual. Do you have this disorder? And we'll put complex PTSD in there. But the problem with complex PTSD is the D at the end of PTSD. It's a disorder. Well, it's not a disorder to respond to threats in the way you're responding to them. That's normal. So yeah, my biggest concern is that we're putting it in the field of psychiatry and mental health, and it'll end up with little white pills treating mental disorders, and it'll cost an awful lot of money for the most part. And if this is a genuine question. If you need 2 years of therapy to work through what you did in your microdosing, do you really need the microdosing? Could we not be looking at alternative models of therapy as well? And I know we are to some degree, but almost all therapy ends up in having a goal. And this is a big issue for me. And I know IFS is very popular at the moment around the world, but IFS wants to map people's stories. And I know there's different views on this, but the way I would describe this is that you're coming to a person, say in IFS or CBT or any other model, you're coming with a map. So you're wanting people to get on the right roads, and you'll say, oh, well, it's their journey. They'll find it out. But I'm saying, in between the roads, there's massive, empty, barren lands. Maybe being in the barren lands is actually where you discover the truth and the experience of who you are. So my fear is that even psychotherapy with psychedelics will become just another kind of adjunct of telling people this is how you should experience your experience, because that would mean you no longer have a disorder. And it's not my reality. I look back in my childhood trauma. I only disclosed that I was sexually abused 3 years ago. I've always known, of course, but I only talked about it 3 years ago. And I had an amazing dream recently, Joe, where I saw the face of the man that sexually abused me. And I took action against him. I don't want to go into the details. And it was a very frightening dream, but oh my goodness, it was so freeing that I can kind of have had an experience that felt like it really happened, where I got to respond to this person in the way I might always have fantasized. But I don't actually want to be rid of any of these experiences. I just want to be knowing that the richness of my life includes all my experiences. And I know that's a lot about what trauma therapy is, but I worry that a lot of medicating and working with trauma in the way that the pharmaceutical movement's going around psychedelics could be about the holy grail of getting rid of trauma, even if it's not intended to. That's what it's going to be sold as, and that's a real fear for me.
This is an amazing conversation, Matt. I hope people like it.
Yeah.
I think it's going to be hard to understand, right? Like this is a really complex topic. It requires a lot of philosophical nuance.
Yes.
And, a lot of people are worried they're going to get sued or lose their license if they start, discussing things in this way.
Yes.
You critique the DSM, you might lose some friends.
Yes. And I what I want to say, I welcome the opportunity to talk with people about this. And I think all of us can do that. I often say on podcasts, if you've got an issue with what I said, flick me an email. I'd love to have a wrap. We don't need to agree, because if we apply the same principles of coexisting, same experience, having different experiences of the same reality, but we can do that together, we're stronger, we're more powerful, and we're richer. And so I've got a wonderful psychiatrist friend in Adelaide. I say wonderful. Yeah. I used to work in the mental health system with him, and we butted heads, and I don't think we had a great deal of respect for each other. And now we both work independently. And he says to me, I say to him, Angelos, where do you think my schizophrenia went? And he says, oh, well, you were misdiagnosed. And I say, well, that's nonsense. I met all the criteria. And he said, oh, yeah, it's more nuanced than that. And I said, well, it's not more nuanced than that, is it? Because the book tells us if you have these criteria, you got schizophrenia. So where did my schizophrenia go? He said, oh, well, you couldn't have had a real schizophrenia. And I say, oh, that's nonsense, Angelos. And he says, oh, don't be silly. Next, you're going to tell me schizophrenia doesn't exist. And I say, yeah, absolutely. How can you say it does exist? Why do I have to prove? Anyway, and we have these lovely conversations. And now we refer to one another all the time. So it's not about having to suddenly go, oh yeah, we totally agree on this, because I really disagree on his formulation of mental disorders, and he disagrees on mine. But I also think that what he does for people is he lets people tell their story and validates that their story is theirs and meaningful. And that you often don't get that in mainstream psychiatry because of the diagnostic underline. So yeah, I think it is a challenging conversation, but it needn't be as frightening, because we both become richer if we have conversations about it. And, I'm not just trying to get it out there, but Suicide Narratives is a document. We've got it on our website. We published it for free because it really is this story of how do we realize that when someone talks about suicide, the goal is not to get rid of it in the short term, because that person lives with this day in, day out. The goal is to get alongside that person. And in doing that, the person may be able to have new experiences, which means they don't only have one option, which is suicide. They now have two options. They have leaving this life and ending their life, and they have being in deep relationship with one or more people who are happy to expose themselves to a very frightening reality that this person's life and our society has meant that this person can't bear living anymore. And that is challenging because it happens, like I'll just name it. I have 3 beautiful daughters, and I presume 1, 2, or 3 of those daughters in their lifetime will consider ending their life. I can hardly say it, Joe. I can hardly bring myself to say it, but they will consider whether life is worth living or not. Mm-hmm. And I'm sitting here, I could almost cry. They're kids at the moment. But I think to myself, I have 2 choices. One is I have the courage to be with the reality, or 2 is that I make up a story to try and pretend I can get rid of it. And I invite anyone working in the field of human relationship, which I would say is what mental health, psychedelics, all these things are. It's hard, and go gently on yourself. Walk in real gentle spirit. Dial up anything you have, but don't avoid being in that deep connection and the courage to face these stories, because again, I say it, we're stronger when we're in this together.
And it sounds like this power dynamic, totally like this power dynamic, like you come in as like a forceful authority as opposed to somebody at their level, and that dynamic's like problematic, I think, at times.
Yeah. And this is micro and macro. I just said something about IFS. I don't know much about IFS, but I also want to say, if someone comes to our clinic and says, I really want IFS, and I might be thinking to myself, yeah, you know what? I'm not sure. Well, maybe I can talk with them and find them a really good IFS therapist. That's not a threat to me. That's beautiful, right? They've come to the wrong place, and I've supported them to go where they wanted to find themselves. Well, do that. And so that principle, I'm only using IFS because I mentioned it a minute ago, but that principle of our job is to support people's journeys. Our job is not to give people a map and tell them which road to drive on.
Yeah, I really want to do a session with you at some point with Lenny. I think a discussion between you two would be really, really interesting, because you're kind of living in this kind of Whitehead framework, and I don't think you've spent too much time there yet. So also, I don't know, where do we want to go from here? Do you want to maybe we're at a bit over an hour, well, a bunch over an hour. Do you want to maybe talk about your websites or any kind of projects you have ongoing?
Yeah, I mean, we can do. I guess I'm, we're www.humaneclinic.com.au, and we've got a bunch of information there around dissociachotic, which is my kind of theoretical framework. But I think more I'm interested in saying, rather than promoting anything, I'm really interested in saying this is really possible, people. And last year we ran a psychotherapy year certificate on being in relationship with non-ordinary states and not using any diagnostic or pathologizing approaches to therapy. And we had 10 people come through this course, a little course, and it was so beautiful. So my encouragement is that we can all do this in our own work in little ways. And the reality is there is a lot of people doing different things in their own little places. And so my encouragement, really, my plea is not to promote my business, but to promote that wherever you are, feel some strength from the diversity of people that come on these podcasts, I listen to them all, and whether you agree with me or Will Hall, or whether you agree with, I can't remember the woman who set up Neon, the recent podcast that came out, forgive me, I can't remember her name. It wasn't my thing, but it was expansive of my mind to listen to her talk. And it was also, she actually is a collaborator and a supporter of me, because whether she's setting up a biotech company and I'm doing therapy, they sound like different spaces. But if we can find the value of human connection in this and feel that when we're taking a risk, we've got other people all over the world taking risks and of ideas, that's how we're going to build a community for change. So it's not about believing me and loving everything I say. It's about what works, what is helpful when you're sitting with the people or yourself that is in need of support, because that might be it is valuable to that individual. So do it. I don't know if that makes sense.
And I want you to, no, totally. So we need to take a lot of risks. Absolutely. This is why I'm kind of in support of people starting cults. I try my best not to start one, but people should. It's an amazing amount of data that we get to then play with as a culture. Yeah. And so another thing, Matt, I remembered finally, if you could listen to the Dr. Craig Heacock episode that was a response to Will Hall, I'd love to chat with you again after that, or at least, see if there's a way to explore that with you a bit further.
Yeah, I'd love to. That'd be, and that would be great, because that's exactly what I'm talking about, is how do we come to terms with the different realities? So yeah, I will. Thank you.
Right. Yeah. The idea that there is not one reality, but this experience soup. Maybe.
Yeah, that's right. And if we can stay with the we all have a phenomenology. So we stay with the phenomenology and we find out all sorts of wonderful things.
Cool. All right. Matt Ball, let's wrap here and let's just hang out and debrief after we stop recording for a moment. And thanks a lot. It's been fun.
Thank you.
And there you have it, Matt Ball. I hope y'all liked that one. It's really fun for me. Probably came through that it was fun in the recording. And I really can't wait to do it again. Looks like we're going to be doing some work with Matt in the future, and I can't wait. Can't wait. It's a really clever and beautiful perspective, especially with his lived experience. So, yeah, and not to mention all the work he's done with people, using these kind of, how do you even phrase that? Non-normative practices. Yeah. So allowing for more freedom, a little bit more humanity, etc., more connection. Yeah. And I hope it was helpful and interesting. And I think that's it for now. If you want to support us, maybe leave us a small monthly donation at Patreon, patreon.com/Psychedelics Today, or tell a friend about your favorite episode of the podcast or this one. And maybe check out our educational offerings over at psychedeliceducationcenter.com. I think that's it for now, everybody. It's Joe Moore signing off from Breckenridge, Colorado for Psychedelics Today. And we'll see you next time.